Really common shoulder condition that we see at the clinic here is impingement. Now, impingement itself is not really a diagnosis. Impingement explains a sort of certain part of the range where the client struggles in regards to shoulder pain. Usually kicks in around in the painful arc sort of region, which is around sort of 70 degrees to around sort of 110 degrees. Usually down in the lower part of the range the client doesn't get any pain, and interestingly the upper part of the range they usually don't get any pain either. So it's usually that sort of middle part of the range here where they start to struggle with pain. Sometimes if it's a chronic case they do struggle with the top part of the range as well, purely because they haven't actually been up there. Now in terms of the structure of the shoulder joint, what you have is the humerus, which is the arm, which sits here, and then you've got your acromioclavicular joint, which sits here, and underneath this area you have lots of structures. So you've got a bursa in there, which is a fluid-filled sac which tries to sort of separate structures, and you've also got your supraspinatus, which is this muscle here which runs through under that space as well. And it's quite a small space. The way that I tend to describe it to clients is that if this is the if this is the acromion and this is the humerus and the arm, what basically happens is that you're impinging on this area here. You're sort of putting pressure on this area here when you lift up the arm. In the lower part of the range it's fine, but when you come up and you're in the higher part of the range, you close that space up and then you're sort of putting pressure on those structures. Okay. Now you can impinge for a number of reasons: poor shoulder biomechanics, inflammation of the bursa, a supraspinatus, which is a muscular issue in that region. You could also have some wear and tear underneath the acromion, or in sort of severe degenerative cases there you actually sort of get a bit of a hook growth on the end of the acromion there as well. The other reason why you can impinge is that the angle of your shoulder blade could be different to what it should be. So instead of the shoulder blade sitting perfectly like so, the shoulder blade could be at this sort of angle, or this sort of angle, which would actually sort of open or close the space at the acromion there. Now, in regards to treatment, it really depends on why you're impinging. So we'll go through a thorough assessment of your shoulder. We'll have a little look at the shoulder biomechanics, your strength of all those muscles. We'll have a little feel around of the structures in the region, and that will allow us to diagnose why you are impinging, and therefore you can treat accordingly. So mobilizations of the shoulder, soft tissue release, structured sort of exercise program in regards to improving the biomechanics of your shoulder, and hands-on manual therapy as well to potentially loosen off some of the muscles such as the trapezius or the rhomboids, which may be overactive in the area. It's really common injury that we see in sort of sports people, gym goers who are creating an imbalance in the muscles of the shoulder, and just everyday people who are doing lots of overhead type activity. If you're up in these areas all day long, painters or sort of manual workers above head, you tend to be creating a little bit of an imbalance there in the muscles, and therefore people can start to impinge. So pop into the clinic, we'll go through a bit of an assessment with you, we'll work out why that is occurring, and then we can get you on the road to recovery.